I had a hard time driving. When I was at lights, I put my car in park because I knew I would fall asleep. I'm like, something's really wrong with me. I went in and I did have severe sleep apnea.
At work, I'm forgetting to do simple things that I used to just keep on top of.
I was always looking forward to my next nap. That was my goal in life, is to when can I lay down?
Before I even left from the sleep study, they fitted me with a machine.
You're tethered to this 4.5-foot hose, having something airtight on your face, and then you're supposed to relax and go to sleep, which was really a struggle for me.
I just happened to go online and see this ad about Inspire, and I thought, oh my gosh, I need to look into this.
The more I read, the more excited I got. And instead of feeling defeated, I felt hope.
Once I met the Inspire team, they helped me with my insurance. It was one-day surgery. It lasted about 2 hours.
Recovery was very smooth. I had no pain.
This little device here is the brains for the Inspire implant.
You put it up on your chest, hit the little green button, and it'll turn itself on. Once I wake up in the morning, it's the same thing. Put it right back up on the chest, and it turns itself off.
There's no mask. There's no device to put in your mouth. There's no machine that you have to clean.
Where before, I was constantly changing the alarm. I need to sleep as long as I possibly could. Now I'm like 5:30, I'm up and about.
At work, I'm much more back to normal. I've since enrolled back in college, going back to school to get degrees again.
I'm back to kayaking. I'm back to riding on the back of a motorcycle.
My granddaughter's in theater. I no longer fall asleep in her plays.
I realized, oh my gosh, what a change this has made in my entire life.
You're relaxed, you feel good, you're looking forward to the day. That's how I feel every day now.
I have a whole new outlook on life again, being happy and being able to do everything I ever wanted to do again.
It's not only changed my life, but I honestly think Inspire saved my life.
For 14 years, this is what I actually slept with. Now, this is what I sleep with.
Welcome back to Houston Life. If there's one kind of food that comes to mind when you think Texas, it is barbecue. Houston is home to dozens of barbecue joints, some that have been around for decades. In more recent years, the city has seen an uptick in craft barbecue. Last week in our Eat Like a Local summer series, we went inside Gatlin's Barbecue, arguably one of the first to bring craft barbecue to Houston. And this week, Chef Chris Shepard takes us to Truth Barbecue in the Heights to explain what exactly craft barbecue is and how they're doing it right at Truth.
I didn't see you there. We're out at Truth Barbecue today. Check this out, man. You're not seeing this anywhere else. Look at this. Briskets on the cooker. We got this cooker sitting outside. 120 something briskets a day. Line forms every day. You're getting the best brisket. You're getting some of the best ribs, some of the best sides. His mom's recipes on all the cakes and desserts. This place is the truth. I hate to say it like that, but it literally is the truth. Let's get in and enjoy this today, huh? So this is Texas barbecue, right? Yeah. This is what you guys love doing. Truth Barbecue, the name. Talk to me about that.
Basically, the name Truth came from, I wanted to stay true to Texas barbecue and be very Central Texas style and use 100% post oak, offset stick burners. And I just wanted to be very true to that craft barbecue aspect of how it started, basically.
Leonard learned the art of barbecue in the backyard with friends, with family, learning times and temperatures, how meat reacted to smoke, through flame, through fire, through coals, through embers. He then took a chance, opened a spot in Brenham, Texas. Small, but mighty. Long lines started to form, more and more briskets on the pit, and then he decided, you know what, it's time to move to Houston, open up the second location. That's where we're at today.
Craft barbecue. What do you consider that to be?
I would say...
And it's a hard question to answer, really.
It's a hard one. Craft barbecue is the evolution of barbecue. I think what craft barbecue moved into is that evolution where you're using Duroc pork, where you're using prime brisket, where you're taking the extra steps. I don't think anybody was wrapping in butcher paper and protecting that brisket. And it was all these little tedious steps to improve the game of barbecue and the overall quality and preserve the quality of it, what makes it craft barbecue. People ask me all the time, they're like, Well, is craft barbecue better than, old school style barbecue? One is not better than the other. You're comparing apples to oranges at that point.
Let's talk about traditional versus craft barbecue. Traditional barbecue tends to lead me down the path of the ribs, the brisket, but then the sides. We'll start talking about just baked beans and coleslaw. I love all of that. Craft barbecue, the newer generation's looking at where they're sourcing their meats, the technique behind it, focusing it in, dialing it in, doing different sides, doing desserts, bringing the barbecue experience to a new level. Neither are wrong, both are delicious.
First off, hold up. Because this needs a moment of its own. Look at that rib. Like that's...
So the funny thing is we use the same seasoning for all of these.
For everything? Now,
I like to be able to taste the, the true layers of the protein. Like with a good steak. You want to taste the beef, you want to taste the crust. Same thing with this. Salt, pepper.
No brown sugar. This right here, that's my favorite piece.
Yeah.
Right, that end slice.
That's where all the seasoning accumulates and all the fattiness and...
See, that's just gorgeous. I think the face of Houston barbecue has changed to the right direction, and it is only going on into the future. So what's next, right? That's a question.
A lot of people say like fusion. There's so many different ways and so many different types of barbecue. We can cook ribs over an offset. We can cook them over direct heat. We can hang them. There's so many different ways to implement so many different flavors of smoke and fire with the same proteins. And I think that barbecue will probably go more so in the live fire direction versus really trying to change this up, because sometimes you don't really need to change it. Sometimes things are better left alone.
Sometimes things are better left alone. You can learn more about Truth Barbecue, including the surprising dish that left Chris speechless when the full barbecue episode of Eat Like a Local airs this fall. And a reminder, the season premiere kicks off September 16th and airs weekly on Saturdays.
Do you feel embarrassed, isolated, tired of having to constantly reassure others that you're not sick? Have you managed your symptoms with medications and sprays only to have them return? If this all sounds familiar, you may be suffering from chronic rhinitis, a common condition that affects over 30 million people in the U.S. alone. Chronic rhinitis occurs when abnormal nerve signals in the nasal cavity cause inflammation and excessive mucus production, leading to a persistent runny nose, postnasal drip, congestion, coughing, itching, and sneezing. Luckily, there's now a non-invasive treatment for chronic rhinitis that can be performed right in your doctor's office with minimal discomfort. The Rynair procedure from Aaron Medical uses temperature-controlled energy to disrupt those abnormal signals and offer you long-lasting relief with zero downtime. That lasting relief means an improved quality of life and a significantly reduced need for tissues and expensive over-the-counter medications. In fact, a recent survey showed that 96% of Rynair patients experience substantial relief from their chronic rhinitis symptoms. So don't let a runny nose run your life. Ask your doctor if the Rynair procedure from Aaron Medical is right for you.
Vivair is an innovative way to provide your patients with lasting relief from nasal airway obstruction by treating and remodeling all three components of the nasal valve without precluding the possibility of a future nasal surgery. Using temperature-controlled radiofrequency energy, Vivair treats nasal airway obstruction and nasal valve collapse to significantly increase airflow by increasing the radius at the most narrow part of the internal nasal valve. In contrast to alternative treatments, such as surgical intervention, the Vivair procedure is non-invasive, incisionless, and office-friendly. To perform the procedure, apply gel to the tip of the Vivair stylus and insert to treat the caudal edge of the upper lateral cartilage. Apply pressure anterior to the nasal bone and maintain a 4 mm lateral deflection, or about the width of a stylus head. Initiate the 30-second treatment cycle by holding the foot pedal and maintaining lateral deflection. You'll hear the console beep twice after 18 seconds of heating, and again after 12 seconds of cooling. Continue along the treatment zone of the upper lateral cartilage, being careful not to overlap treatments. Apply treatment if needed to the inferior turbinate and septal swell body, applying mild pressure to the head of the inferior turbinate to treat hypertrophy, and to the septal swell bodies along the anterior portion of the septum. After being treated with Vivair, patients reported significant improvement in nasal breathing, sleep quality, and other quality of life measures through 2 years post-treatment. Connect with us today to learn how to bring Vivair into your practice.
Sinuses are a series of interconnected hollow spaces in the skull. Their walls are lined with mucus-secreting membranes. Small hairs sweep the mucus out of the sinuses so it can drain out through your nose. These mucous membranes may become infected or inflamed because of a cold or allergies and can swell up and block the nasal passages so that the fluid from the sinuses can't drain. Buildup of fluid in the sinuses causes pressure and pain. Doctors call this sinusitis. Acute sinusitis comes on quickly and then leaves. With chronic sinusitis, people have symptoms virtually all the time and take many courses of medications such as antibiotics to treat the inflammation. Severe sinusitis may require surgical opening of the passageways with rigid steel instruments placed up through the nostril to remove bone and tissue blocking the drainage. Recently, a new less invasive technology called balloon sinuplasty has been introduced. Using this technology, a balloon catheter is delivered to the blocked passageway and is gently inflated, widening the opening of the passageway and thus allowing drainage and relief from the pain and pressure.
Daniel McKee was diagnosed with sleep apnea several years ago.
I complained to my doctor of daytime tiredness. I was just extremely exhausted throughout the day.
Patients with the condition have their upper airway closed during sleep, so they have dangerous pauses in breathing. Daniel tried devices for the mouth and the CPAP mask, which blows constant pressure to keep the airway from closing.
I'd wake up in the middle of the night and couldn't tolerate it any longer.
So he enrolled in a study at Medical College of Wisconsin to test a new device called Inspire. It's a pacemaker-like generator that's placed in the chest along with 2 wires. When activated, the system senses breathing patterns.
Or actually stimulate one of the nerves that goes to the upper airway by an implantable device. And this helps hold the airway open during sleep.
Patients use a remote to turn the system on and off when they wake up. The FDA has now approved the device for patients with moderate to severe sleep apnea who are not able to use the traditional mask. Doctors say getting sleep apnea under control is key because it's linked to several health issues.
High blood pressure, increased risk of stroke, and a number of other problems like that.
Daniel says he's getting a good night's rest thanks to the new technology.
I sleep better at night. I wake up more refreshed. I don't snore anymore.
Danielle Nottingham, CBS News, Los Angeles.
Welcome back to Houston Life. We are continuing our summer series where each week James Beard award-winning chef Chris Shepard will introduce us to the people and places making Houston's food scene one of the most eclectic and delicious in the nation.
We are so lucky to have the food scene we do. And today we're headed to Burger Bodega, where folks are lining up literally to try their smash burgers and chopped cheese. You don't know what chopped cheese is?
I don't.
Well, Chris will take us inside for a look at the New York-inspired favorites.
So we're at Burger Bodega, Washington Avenue, voted best burger in the city by the Culture Map Tastemakers. It's only been open for like maybe 7 months, but they're doing it right here. So let's go in, let's have a talk with the boss. Let's check out burger and the chopped cheese. That's important. Important info for you to know. Let's go.
You know, somewhere down the line, fast food.
Order for Pablo.
Operations meets passion for burgers meets food influencer just all came together, and that's how Burger Bodega came about.
I'm gonna go ahead and tell you it's kind of a perfect storm too.
Thank you.
Because a lot of people know the burger, a lot of people know the Houston Eats, and then when you can put the two together, it's really a perfect, you know,
Thank you.
the triangle of happiness.
Thank you, Chef.
I first met Abbas when he popped up on my Instagram feed as Houston Eats. We met up and connected over a shared love of Houston's food scene. As Houston Eats took off, he decided to share his love for burgers by doing pop-ups around the city. In 2022, he put down roots, opening Burger Bodega on Washington Avenue. It just took off like a rocket.
Your burger's not just a burger. You have a specific method, a specific style of beef, right? It's a certain fat percentage, a certain grind percent. It's like everything down to like, you want it this way, this is how it's gonna go.
We were very intentional with the type of beef we use, the cut we use, and of course halal as well, right? Because we're catering to everybody.
You do a smash burger, but what I see as smash burgers is I see people just like spreading it out on a plancha. So it's got that super crisp, but that's all it is. And that's not what I get here.
Yeah, no, we want our beef to shine as well. We don't want just crisp, we want to show off our beef while also serving what makes a smash burger great. We want it to be shown when someone takes a bite, that first bite.
Rivaling the burger on his menu, Abbas has brought a bodega specialty from New York to our beloved Houston. Never heard of it? Let's break it down for you. Chopped cheese is everything you would find on a burger. The burger, the cheese, the sauce, the lettuce and tomato, the pickle, all chopped up and served on a hoagie bun.
You know what makes it special? That sauce.
The chopped cheese came from the bodegas in New York, so I was like, all right, it's natural. Burger bodega, you know? So you kind of get, it kind of tells the story of both things. When I got into this, I knew I wanted to do burgers and or chopped cheese. So I was like, all right, burgers and chopped cheese. As I got more and more into it, I had to obviously research what a chopped cheese was, and I had to, do right by the chopped cheese. I'm not just gonna Google it and be like, all right, it's on my menu now. I have to go to New York. I have to immerse myself in the culture. I have to see where the chopped cheese came from, the first people who made the chopped cheese. So, tried it, I was like, man, this is amazing. I gotta do this, you know what I'm saying?
I mean, let's talk about Burger Bodega. Burgers, chopped cheese, you can't go wrong. If you want my recommendation, just order it all.
Wow.
I'm sorry, can I just pick my jaw up off the floor?
You're going to be okay, Lauren Kelly?
Rolling over here.
I've never seen anything quite like that.
I've never seen a chopped cheese, but it's one of those things where you don't know you need it until you see it and you've learned about it, and now I need it. I need it.
Chris says, you're welcome, Lauren Kelly.
Thank you, Chris.
Hey, and by the way, Burger Bodega, so they've teamed up with some other local restaurants in the area, and all month long they have some specials for AAPI month.
That's wonderful.
So get out and check it out.
Yes, I will.
All right, Chris, thank you.
Torture, and every spring it actually got worse and worse.
Julia Fomenova has been dealing with severe allergies for most of her life and even began to dread the coming of spring.
I couldn't take my kids outside to the park. I couldn't enjoy the beauty of it, the beauty of the nature. It was a torture for me, for sure.
But she found relief in the form of allergy drops. They're taken at home and combine her specific allergens into a serum that she places under her tongue.
I did not have allergies this spring. for the first time in my entire life.
The drops, called sublingual immunotherapy, are a replacement for allergy injections. They aren't for every sufferer, but can be a game changer for those who hate needles or don't have time for weekly doctor appointments.
You have to select the patient who will listen to the dosing that you have prescribed for them, because if you take too many or try to titrate it on your own, it can be dangerous.
Traditional scratch testing is still needed to determine the particular allergens, but doctors agree allergy drops are an effective new way to get relief.
It changes the severity. For some, it's miraculous. For others, it's better.
Doctors say the drops may have some side effects.
The drops, you can even get swelling in your mouth or even tongue swelling, which can be quite scary.
But Fomenova said the tongue irritation in the first month was a non-issue, and she adds that the drops have done more than just get rid of her allergies.
My thinking is better, I'm focused, I can enjoy life, and it's worth everything, honestly. It saved my life.
Allergy drops are not FDA approved or covered by insurance, and more studies are still needed to determine things like exact dosage for patients. Ali Bauman, CBS 2 News.
And the patient we spoke to says she spends around $100 a month on her drops. Doctors emphasize regardless of which treatment patients take, they still need to be closely monitored.